From County College of Morris, this is CCM All Access.
Hello, and welcome to CCM All Access, the program that brings you news and information from the County College of Morris. Students at CCM, members of the community, people doing good things. I am your host, Daniil Barkov, and we are coming to you from Alex DeCroce Media Center on the CCM campus. Our guest this evening is Mr. Bryan Lemme. Bryan Lemme is an assistant professor of health and exercise science here at CCM. Hi, thank you for joining us.
Sure.
So you are the assistant professor of the health and exercise program here at CCM, correct?
Yes, health exercise science.
Exercise science, yes. Can you please tell us what you do here at CCM?
Sure, be happy to. I teach. One of my core classes is exercise physiology. I also teach nutrition, online, face-to-face, first aid. I do online rather. And I used to do the not quite an internship program, but it's more of like a field experience program. I used to run that, and then I passed that along to one of my coworkers in my department, Bill McHugh, who has 25 years experience in owning his own business in the industry. So I kind of felt like it was time to pass it on to someone who knows everyone in the community. So he now took over that role, and on top of that, I was fortunate enough to be able to be a part of, or a co-director rather, for the Center for Teaching and Learning, located in SH 120 or Sheffield Hall 120. And there I help a lot of faculty or just employees on campus, either with instructional design, putting courses together, or if they need any help with technology in the classroom, which is a big push and drive in education. Higher ed is still trying to catch up a bit to what they do in K through 12, although I think we've done a pretty good job here. So I'll have a lot of faculty come in and need some Blackboard help, or just again, instructional design with their courses, setting their courses up. Also go through training for our distance education courses as well. Also work with the virtual campus. And if anyone has any questions about anything, if it's pedagogy or, again, if it's anything to do with technology, computers, accessibility, anything along those lines, even workshops. We run a bunch of workshops as well, just to enhance the professional development aspect of it. So it's a big role with a lot of things. So it's almost like I run it with someone else as I'm a co-director. So I run it with Debbie Poach. So she's in the math department. She's actually, I don't know how she does it, I give her a lot of credit, but she's an assistant chair in the math department, and she's a co-director at the CTI.
Oh, wow.
So,
okay.
Yeah, so she has, I don't know how she pulls it off. I give her a lot of credit for it.
That's also impressive too, because you're the head of the health and sciences, and then also doing all the assistant with like Blackboard and stuff like that. That's definitely a lot of work as well.
Yeah, it's definitely a lot of work. Our department chair is actually Dr. Michael Paul in the Health and Exercise Science department. There's about 4 of us, and then our administrative assistant, which is Marisol. And at the CTO we have an administrative assistant as well, and again, it's just Debbie and I, and we work very closely with the virtual campus, so a big push initiative that we have on campus right now.
Can you please tell us about some of the classes the program offers here at CCM?
Sure. Our main classes, I'll go with our core classes. We have others. We have Pilates, weight training, and cardio conditioning, a couple other courses that you might see other people from the other programs come into. Nutrition's a big one.
Yeah.
Again, we have first aid that a lot of people take. We get a lot of nursing students.
I didn't even know we had a first aid class here at CCM.
Yeah, first aid class.
Wow.
Believe it or not, we have it. So if you're interested, you can.
Yeah, that's what type of major does that entail specifically, like first aid?
It's just it's a course that's open to anyone really on campus.
Okay.
Yeah, so it's a 3-credit course, and then our students get also have to go. They don't have to, but they can get their their CPR certification.
Oh wow. Okay.
Yep. So, and again, just learn general first aid. So and there's some hands-on experience if you have in face-to-face. When it comes to the virtual world, it's a little more challenging, but I worked with our instructional designer here to make it more realistic. And so I started incorporating like virtual labs in my online course for the first aid. And that's actually been pretty successful, at least I feel on my end. But it's interesting because then, again, you miss that hands-on experience, which you almost feel is not quite enough when you're doing something like first aid.
Yeah.
So I kind of brainstormed with our instructional designer, how can I make this more hands-on? Because a lot of people learn that way. And just to kind of evaluate putting the theory to practice idea and just kind of put that within the course. So we came up with that.
Okay. Now, this is mainly because I'm a little bit uneducated on this topic. What kind of careers can students look forward to who go into this program? Like, what kind of careers can they look forward to attaining? Yeah.
All right. So some can get into occupational therapy, which actually requires a master's degree.
Okay.
So they'll have to go through more schooling. Physical therapy is a very common one. A lot of our students actually want to get into physical therapy. They can go the exercise science route or they can go the biology route. So a lot of the prerequisites are actually biology courses. But we do have in our program, it's not just, a lot of people think it's just exercise, lift weights, put them down, that kind of thing. It's just, but it's more than that. It's actually a very scientific background. So you leave the program with a very strong background in science. So you can kind of take that in multiple directions. A lot of people become physician assistants eventually, clinical exercise physiologists, where they work with people who have chronic diseases.
Oh, wow.
That's actually not initially what I was aiming for, but I ended up going to East Stroudsburg University and going into a clinical program. And I just found that to be the most rewarding aspect of it. Working with people, kind of getting people with activities of daily living, for example. Older individuals or people might have had a heart attack. You work with people who might have been post-stroke after they go through rehab. So you take them and bring them to that next level. And so it's a very rewarding career. Cardiac rehab is where you'll find a lot of clinical exercise physiologists. You will find some as personal trainers. Some people might choose to go that route, which can also be extremely rewarding. Generally work with healthy population.
Yeah, here it's a very high-paying job.
It can be.
Yeah.
If you have a lot of clients, it certainly can be. And especially if you happen to go out to LA.
Yeah, that's what I was about to say.
Land a good gig over there. Actually, someone I went to high school with did that. She became Madonna's trainer.
Oh, wow. No way.
Yeah.
Wow. Okay.
So, but yeah, if you get that lucky, which is very rare, so you can do something along those lines. But yeah, you can do pretty well.
So a lot of different careers you can basically go off.
There's a bunch of different careers. Yeah, I just named a very few. But yeah, you can go very broad.
If you go into basically careers where you would be like assisting people, you don't need any type of medical degree for that as well, or no?
Depends. So we're considered allied health. So we will assist people. We don't go quite as hands-on as a physical therapist would, or potentially an occupational therapist. But you will see some helping stretch other their patients or clients. Setting up a ECG or EKG, most commonly known as. So, or even just looking at the monitor a lot of times, working with people with COPD, or they have lung issues or breathing issues. And a lot of times they'll be using an oxygen tank at the same time, so you kind of have to be prepared for those things. And you might have to go hands-on with that, for example. And then we also take people who might have some kind of orthopedic issues as well. Again, usually post-rehab, we take those individuals and just, as I mentioned before, progress them even further. And just make sure that they're getting better and continuing to get better in a safe manner. Because the conversation we had before, there's a lot of people don't know where to start. Or where to go, or how to progress, or make that keep improving. So that's where we come in. So, and then we also take a medical history as well. So again, we're considered an allied health profession.
Yeah, I can see you have a lot of very good programs here at CCM, and I actually didn't really know about a lot of them, so I look forward to talking to you more about them. And now we will take a quick break. Stay tuned. We'll be right back.
Not all County College of Morris students look like me.
Some look like me.
Or me.
Or me.
Or me.
We all come to CCM at different stages of life.
And for different reasons.
I plan to transfer to a university.
I'm training for a new career as a nurse.
But we all know one thing.
CCM is where we want to be.
So check out the website.
Check out the website.
Check out the website.
And let CCM connect learning and your life.
And we're back at CCM All Access. I'm Daniil Barkov, and we're here with Mr. Bryan Lemme. Hi, how are you? Can you please tell us, specifically for myself, and I know for a lot of young students, a big problem with specifically like health and exercise is getting started. I know there's a lot of information, specifically with nutrition and, with working out as well, that I personally just don't know where to begin or how to get started in customizing a plan for myself.
Yeah, that's actually a big issue for a lot of people. You know, all ages, or even older adults, college students, high school students, you name it. Most people there's not really a resource out there, or a lot of times the resource ends up being Google, which doesn't really give you reliable information, or at least you don't know where to find reliable information. And so that's why a lot of times for students, I'll guide them in certain directions, to find credible resources, because that's such a crucial thing, considering the fact that anyone can put anything they want on YouTube, or again, just on the internet in general. So when it comes to nutrition, I guide a lot of people to MyPlate. It's myplate.gov. It's a great website, government website, where you typically find credible information. They have all sorts of different planners on there, even recipes. And one of the things that I do is my nutrition class. I have the students look and play around with it, answer some questions. Would you like, would you didn't like, would you recommend it? Every single one of them has something positive to say. And it really guides you, whether you're physically active or whether you're a sedentary individual or whatever it is, whoever you are, vegetarian, different populations, if someone's pregnant, whatever it might be. So it's really just a whole robust resource that people can utilize. What's great about it also is they have a lot of different tools and calculators that you can utilize. So if you're not sure how many calories you should be consuming a day, again, you can find any numbers out there that are ridiculous. So if you want to find legitimate information, I would highly recommend, if you would go there and you can find all sorts of great things. One of my favorites is Eating on a Budget. And it shows you different recipes and gives you an idea of how to actually consume food, proper food, healthy food on a budget. So it's, again, it's a resource I would highly recommend you check out, or just anyone in general. And in terms of actual exercise, getting to the gym and staying there, as you mentioned before, it's a big barrier. And we were talking before, most people go to the gym usually. When do you typically see people go to the gym? When is it flooded with the most amount of
right
people?
After New Year's.
There you go, right? So right after New Year's. Then as soon as about a month or two hits, you start to see the numbers deplete, and then I finally get my gym back to myself. And it's because people are setting these sometimes unrealistic goals. Take it step at a time. Just little small goals is really the key to it. I always also recommend to people check out SMART goals. That you can Google. That will be safe to Google. But so it's just setting up little incremental goals that you can achieve. And there will be a point where you might hit a plateau, which is fine. That happens. And sometimes it's a matter of taking a rest, or maybe even just changing something up. And a lot of people don't realize when you're in the gym, you're breaking down. When you're resting, you're building. So a lot of people overdo it, and then they get injured, and then guess what? You're out of the gym for a very long time. So what it really comes down to is also, it's called biomechanics. The biomechanics are doing things properly, the proper lifts, not rounding your back. When you pick an object off the floor, don't round your back. Right? So you want to protect your spine, because a lot of people just picking something light up off the ground, they can just blow their back out.
Lift with your legs, right?
Lift with your legs,
Okay,
lift with your legs,
I want to make sure I didn't say lift with the other way around. Okay.
And then, chest up, look up, that kind of thing. So, but there are some good resources out there as well. NSCA, the National Strength Conditioning Association, has great information and video showing how to do proper mechanics. Don't overdo it. Don't overload it. And again, just not everyone is the same. So people can respond differently and do respond differently. So that's also something else to bear in mind. Your friend or someone you know might make better progress or certain kind of progress than you do. And just because they're doing something in particular doesn't mean that you will respond the same way. We respond differently.
Yeah.
So that's also something else to bear in mind. Genetics, you can't choose your parents. So it's kind of, you're stuck with what you have.
Yeah.
In a sense, so you just have to be careful. I've also seen the other side of it too. I've seen people, they do the same thing for 6 years straight. You know, I work at a hospital per diem as well on the side, and I'm at their medical fitness center, and I work with a lot of clinical populations, chronic disease, which clinical exercise physiologists special in. And with these particular individuals, again, this is where I've seen people doing the same thing for 6 years because they just didn't know.
Yeah.
And that's where a lack of resource is. And that's where hopefully one day insurance will cover, our services and what we do. And we've been pushing for licensure as well. So hopefully that will happen. There's been a couple barriers along the way, but there's another organization that I'm a part of, their legislative committee, that's working on trying to get that going in all the different states. But again, in terms of people getting and staying at the gym, it's a lifelong commitment.
Yeah.
You don't just go for a little while and just, I don't feel like going anymore. It just, you lose it, and you lose it within 2 weeks or so. It depends.
Yeah.
Aerobically or even with strength training, you lose it. You lose it faster than you gain it. Unfortunately, our bodies work that way.
I feel like a lot of it is a lot of people expect to see instant results right away.
Yes.
And as soon as they don't, they just automatically assume that they're doing something wrong or they have to change it up and they don't stick with the program. And I think that's definitely a big issue that I had. Now, another question. I know a lot of, at least I've started to figure out, and I know we talked about this before, how big of a portion nutrition is of like health and specifically working out and being fit. Can you talk a little bit more about that?
Yeah, that's actually an excellent question. So I'll use blood pressure, for example. So with blood pressure, you can get a decrease in blood pressure through diet. There's something called the DASH diet. It's a dietary approaches to stop hypertension. And it's actually just a great diet overall to be on. Usually the sodium content is lower. That's associated with higher blood pressure, caveats to it, but it's typically associated with high blood pressure. So if you can keep that lower, around 1,500 milligrams or so, or again, if a registered dietitian or doctor tells you otherwise, listen to them. But that can help reduce blood pressure. And then what's really interesting is this is where exercise is medicine. When you do a bout of aerobic exercise, afterwards, your blood pressure will drop a couple points. And I see this all the time. Anecdotally, I see it as well. And then it works more for people who have hypertension. And so that's a big change. And people can actually make these changes, these dietary changes, and just becoming physically active. The recommendation, 150 minutes a week of moderate physical activity.
Oh, really? That's it? Just a week?
Yeah.
Wow. I would have done, okay.
Minimal, but yeah, of the week, and that's moderate, so that could be like a brisk walk.
Okay.
Then there's 75 minutes for vigorous, is where the guidelines, what they recommend, and that's the CDC recommends, and American College of Sports Medicine, as I mentioned before. So that's the for vigorous. So, or you can do a mix of the two, which is generally what most people end up doing. So, but yeah, that's all it takes. And a lot of people don't realize that just being physically active and just doing that 150 minutes a week of moderate, and for some people that moderate is just even house chores or gardening or just anything along those lines. But a brisk walk is very common. Most people are accustomed to it, and it's not too heavy on the body or impact-wise. So those changes can make a difference. But to go back to what you had mentioned before, they're both vitally important. To lose weight, both vitally important. I would probably lean a little more on the side of nutrition.
Okay.
Because you can completely ruin your, any weight loss or changes that way, or fat loss. But also, I was mentioning before with hypertension, if you were to lose that weight, then you can have significant decreases in blood pressure.
Oh, wow, okay.
Yeah, and that also goes for things like diabetes as well, risk for cancer. There's also risks for strokes.
Okay.
I mean, you name it. It's the list.
Basically, just work out and eat healthy. That's if you want to live.
Yep.
Yeah.
Yeah.
Okay.
Yeah, if you want to live a happy, healthy life,
Yeah.
yes, absolutely.
I feel like that's a big problem, specifically now with people, because it's more of just immediate rewards of whatever you want, not looking forward for like the, what's going to happen in the future. You know what I mean?
Yeah, absolutely. And then, one day you want to be able to do everything yourself.
Yeah.
It's activities of daily living, they call it. And then that's just, you want to be able to carry your groceries in.
Yeah.
You want to be able to walk, drive your car. There's all sorts of different things that you want to be able to do by yourself, not have to rely on someone else to do. So that makes a big difference in people's lives.
Okay, thank you very much. We are going to take a quick break, and when we return, we are going to take you over to the exercise science lab. Stay tuned.
Not all County College of Morris students look like me.
Some look like me.
Or me. Or me.
Or me.
We all come to CCM at different stages of life.
And for different reasons.
I plan to transfer to a university.
I'm training for a new career as a nurse.
But we all know one thing.
CCM is where we want to be.
So check out the website.
Check out the website.
Check out the website.
And let CCM connect learning and your life.
Hello, and welcome back to CCM All Access. I'm here with Professor Bryan Lemme in the Exercise Science Lab. So, Professor, can you please tell us about some of this equipment here?
Sure. Some of this equipment here that we generally use in our classes, the one actually right behind you is known as the Monarch cycle ergometer. And we use this quite often for aerobic testing, and we can also use it for some anaerobic tests. This one is very frequently used, very easy to take blood pressure as someone's not bouncing around, so it's easy to kind of grab their arm and then take blood pressure on it, easy to hear. Also good if people have orthopedic issues, there's no impact, so this is a good one to utilize. It's different than your typical bike because this actually is, the resistance is applied through this knob, and this resistance, it pulls this strap against the flywheel, which is in there, and it spins, you won't be able to see it. And we actually have a pendulum on the side that you won't be able to see either. Over here, actually this is a good example of the pendulum. So this one is one of our newer ones, and this is, what's great about this one is that it's controlled through the computer.
Oh, wow, okay.
So I can have it where it's known as a Wingate test. It's a 30-second test all out with about 7.5% of your body weight in resistance. And either the subject themselves can drop the basket, so this basket actually lifts up with weights on it. And then if they hit the button, it drops immediately, and then that way the resistance is applied instantaneously. What's nice about this is that the computer can count the revolutions, the amount of pedals. So it gets very accurate as opposed to someone actually sitting there and counting it. So you can imagine human error occurs quite often. We also have some resistance training equipment over here. And one of our really big ones, this is one I use in particular with my core course I was discussing earlier, the exercise physiology course. This one is actually the metabolic cart. We have two of them, which we're very lucky to have. And one that's used, it's a standard, it's known as Parvo system, but that one is a standard in the industry and also for all research, government research to even the military uses it.
Oh, wow, okay.
Yeah, so it's the most accurate one. It's the gold standard of it. And actually one of my colleagues, Professor Kelly Miniter, right over there, has, she uses another really interesting one, which is, we have the Ekg machine right there, and we also have underwater weighing. So she does that with her students in her course, exercise, measurement, and prescription, so, which students take after my course, typically.
Now, this machine right here, what does it measure specifically?
So this machine is actually quite interesting. So it measures the gases. So it measures the amount of oxygen you consume or you take in, and it also measures the amount of CO2 you expel. So you can find quite a few interesting things with that. You can find out how well the cardiorespiratory system is actually functioning. And what's also interesting about it is you can find out exactly what nutrients you're oxidizing, or in other words, burning or utilizing. So at rest, we're primarily using fat. Again, there's caveats to that one as well, but primarily using fat. And I can actually measure that and see that based off of the combination of oxygen and CO2. So, and as someone starts to exercise at a higher rate, they start to use carbohydrates more for energy, and that will be reflected through the numbers that I see in here. as the subject would be pushed a little harder and a little further. And a very common protocol is known as the Bruce protocol, and it's been around for a very long time. So I can grab Kelly right now, and could just kind of give you a general idea of what this test entails and what it looks like. So it could be done on a treadmill, it could be done on a bike, cycle ergometer, someone pedals with their arms. So it can be done in many different ways. It can actually be done with steps as well. But this is a very common one. Most people are very comfortable walking. Not everyone, but a lot of people know how to walk. And so this is a very common one to utilize. So this test goes in stages, and the stages just kind of increase every about 2 to 3 minutes. So in this case, we're going to do every 3 minutes. It will pick itself up.
How long does the test usually last?
Depends on how long my subject can go.
Okay.
Yeah. And it also depends on the protocol you use as well. But it's a good question, because we do want to try and get it where it's not too long, because then I didn't choose a good protocol for the individual, or too short means I chose one that's too difficult for the individual. So it also is kind of the person who's running the test has to kind of know their subject a little bit, or take a pretty good guess as to what they're capable of. So this, at first when I start this, there should be, treadmill won't start just yet, shouldn't. Okay, but initially, so I just let the gas, it wants me to calibrate with the gas in the room. And before I even, we came in here, I calibrated this. And so that entails me setting this up, and with this 3-liter syringe it's called. And
wow.
I had to actually calibrate it to a certain degree, and if you mess it up, you start all over. It's big headache. So I usually do it for the students come in. And then we have gas, and there's gas tanks over there. So we have gas tanks of a certain gas mixture, and that all works with the calibration within the little processor in there as well. So it's all computerized, which is nice. And there are other methods to do it as well. All right, so now that's stabilized, I can put this on.
I'm very excited to see this machine.
Yeah, it's very interesting. The students really enjoy this as well. When it comes to volunteering, I do have a decent amount of students who want to do it. And
I can imagine.
Yeah, you do find some great information about it as well. To actually get this done at a professional to do it, who can run it, typically an exercise physiologist, to run it, it costs quite a bit out of your pocket. So it's nice that we have this capability. We're lucky the college was able to give us this. So, and we're lucky also because our lab is stocked with equipment that you generally don't see. So we've been pretty fortunate in that sense. So I'll begin the test. So are you ready? All right. So treadmill will start.
And all the data will be displayed there on the screen.
Yep. So all the data will be right there. And typically I would have a heart rate monitor hooked up as well. You can take blood pressure. What ends up happening is that with the blood pressure, when people start running, you can't really grab it. So go ahead, you can step on. So this is, and what makes this very uncomfortable for this test is that the incline on this particular treadmill can go all the way up to 25%. I tried doing it myself just to see what it was like. And a normal treadmill can't do that. So it's, imagine with this particular test, the grade goes up really high, and it's like you're climbing this giant mountain, it almost feels like. So that's a lot of issues with this particular test is that people get fatigued, and it's not because of their, they're not limited because of their cardiorespiratory system, it's more muscle fatigue. As you can imagine, walking on a big incline, it's not very common.
Is it supposed to be done with an incline, the test?
That generally can be, it's usually done with an incline, which is actually a good question, because there's other protocols. Sometimes I have people who run marathons in my class, and I'll set up a running protocol for them. So what happens is, it's you set a certain speed that they're pretty comfortable at running, and then I'll calculate out a bunch of different things. But then I set it at a set speed, and then I have it, and they're running off of that, and then I have it increase in incline over 2 minutes, a 3-minute period.
Now, how long does an individual have to do the machine for you to get the results that you would normally like to see?
It's about 8 to 12 minutes is what we're aiming for.
Okay.
But it doesn't always work out that way.
Yeah.
So,
Okay.
for various reasons. In this kind of case, this right here, this button, this is as soon as the subject hits that or the individual hits that, this treadmill stops instantly. So I always give that warning, watch
Yeah.
out. If you hit that, it's stopping. I don't want you to fall. So, and then in a lot of cases, you should have something from the ceiling that might have a harness coming down that's attached to the ceiling. And that way you have the actual person will be willing to push themselves to the max, which is what you're looking for. Because most of the time you can't get them to their absolute true max because it's hard to do.
Yeah.
You get fatigued, tired. You're asking them to go until they drop.
Yeah.
And now if with nothing supporting them, they're not going to do it most likely. So.
Is it difficult to breathe with the mask on as well? Or is it?
Yeah, it can be pretty difficult
Yeah.
with the mask. That sometimes can be another issue that we run into, or I run into. And the mask tends to be the other one. Actually, I brought it over here just to kind of show. So this was the original setup. Since this is a little older, we're getting a new one. But this goes on someone's head, and this fits in. The other piece broke off, but this fits in here.
Okay.
And then they have to wrap their entire mouth around this. And they have to bite onto it with their teeth. So your mouth gets very dry.
Yeah.
And you also, can't see it, but over here there's a little spit catcher. So there's one that comes out from that, and then there's one here before it hits the machine. And those make sure the moisture doesn't get into the machine itself. There has been cases where I've learned wear my gloves, stand back, be careful, because once they hit that, they're done, and they just rip everything off. And when that happens, it sometimes just spills.
Yeah.
So you have to be careful with bodily fluids. But yeah, so over here you can definitely see there's some interesting information on here. So you can see that the respiratory rates, you can see how many breaths a minute she's taking. You can see on here the VO2 I was talking about. And you can also see something called METs, which is metabolic equivalence. And then that was the RER, is what I was discussing before, how you can tell like what nutrients they're actually utilizing.
So this is very in-depth. This gives a lot of information.
It does.
Wow.
Yeah. So,
I've always seen this machine in like commercials and you know, like the $7 Million Man, like the old TV show, the intro they would have him running on that. I've never actually seen one in person. This is very crazy.
yeah, it's kind of unique to see or unique to have. You know, so we're very fortunate to actually have this and have our students do this.
And you said you have 2 of these machines?
Yeah, the other one's right above it.
Oh, okay.
They're nothing huge, but they're just
Okay.
expensive. So, and then again, they're just, this other one does over 100 labs.
Oh, wow.
Not just with the metabolic aspect of it, also it does all different kind of muscle measurements and other things you can do with it as well. So we've been very fortunate. We do a lot of we work with spirometers as well, hand grip dynamometers, strength, blood pressure. Our students get a whole array of a whole background of how to actually hands-on run all of these. So we really do go from theory to practice in the classroom, which is really nice.
I actually had no idea we had these. This is even here at CCM. This is very impressive. There's a lot of, like especially the machine there that you were showing me with the pressure that you can make it negative and work out with it. Wow, this is very interesting.
Yeah, we've been pretty lucky.
And are there any other type of machines that are that you would like to show us? Anything else that's...
Those are the fun ones.
Okay, all right. Okay, all right. Thank you very much.
Yep, of course.
All right.
Anytime.
This has been another edition of CCM All Access. See you next week.